I'm Dr. Nadeem Raja. You are watching my YouTube channel, Dr. Raja Nadeem Official. Please do subscribe my channel and press bell icon button. Today I'm going to talk about sciatica. It is said 40 to 50% people in the world suffer at least once in lifetime with sciatica pain. Sciatica, what exactly is sciatica? Sciatica refers to pain caused by irritation, inflammation, pinching, compression of nerve that radiates along the path of the sciatic nerve, which branches from lower back through your hips and buttocks and down each leg. So typically, sciatica affects only one side of your body. Sciatica most commonly occurs when a herniated disc, bone spur, that is the overgrowth of bone in the spinal vertebrae, on the spine, or narrowing of the spine, that is also called as a spinal stenosis, compresses part of the nerve. Sciatica pain can be severe. It appears suddenly or gradually, depend on the cause. Most cases, pain resolve with non-operative treatment in a few weeks' time, but surgery is indicated if the pain is very severe or the person loses control over bladder as well as bowel. So what are the signs and symptoms of sciatica? So very important, this pain radiates from lower spine to the buttocks and down the back of the legs. This is the hallmark of the sciatica. So person feels discomfort along the nerve pathway. So the pain vary widely from mild itch to sharp, burning, excruciating pain. Sometimes person feels like a jolt or shock, but pain worsens when patient coughs or sneezes. If person is sitting for a longer period, it also aggravates the pain. Patient feels numbness, tingling or muscle weakness in the affected area. So the common causes of sciatica are when the sciatic nerve becomes pinched, usually by a herniated disc in the spine or by an overgrowth of bone in vertebrae, and more rarely the nerve can be compressed by a tumor or damaged by a disease such as diabetes or injury or accident. So what are the common risk factors? So who are at risk of suffering with sciatica? So people who had injury, elderly people. So age-related changes in the spine such as herniated disc and bone spurs are the most common causes of sciatica. People who are obese, they are at risk of suffering with sciatica. Occupation or job that requires you to twist your back, carry heavy loads, or lorry drivers, so they are at risk of suffering with sciatica. Prolonged sitting, diabetes, smokers. If the backbone or spine is not strong or muscles are not strong, so that could also lead to sciatica. Osteoarthritis is an important risk factor. So what are the common complications of sciatica? People suffer with numbness, so that means loss of sensations. Muscles become weak. Patient can lose control on bladder as well as bowel. So how it is diagnosed? So diagnosis is always based on the sign and symptoms, patient's history. Doctor also check muscle strength and reflexes. X-ray can be done, MRI, CT scan, that is called as CT myelogram. In this CT, dye is injected into spine to check spinal nerve and spinal cord. So whether they are normal or is there any abnormality. There is another test which is called as electromyography. So this test measures the electrical impulses produced by the nerves and the responses of the muscles. This test can confirm nerve compression caused by herniated disc or due to spinal stenosis. So how sciatica is treated? So of course pain control is very important. So pain anti-inflammatory as well as painkillers are suggested. For example, different medication, paracetamol. Some medications are given for the muscle to relax the muscles, narcotics, but these are all prescribed medicines. Some medicines are prescribed for a peace of mind. So all these are prescribed medicines and should be prescribed by a specialist, and please do not take without consulting your doctor. Physiotherapy is very important, and sometimes injection is also given in the spine. Surgery, as I mentioned earlier, if the pain is very severe or any patient who loses control over the bladder or bowel, so then surgery is indicated. Please do exercise regularly, sit in a proper position, be careful in weight lifting. These are the best strategies to prevent sciatica. Thank you for watching this video. Thank you very much.